female, is visiting the community health clinic with the complaints of low mood and low energy for over 3 months. A registered nurse is completing the depression screening for this client. Which of the client statements alerts the nurse that this client may have the potential diagnosis of major depressive disorder? So before we go ahead and start analyzing the given options, we would have to make a complete sense out of this given statement. So what are we looking to choose the correct answer? So we are looking the client statements that triggers the nurse that this patient may have a diagnosis of depression. Select all that apply. Option number 1, I gained 5 pounds over the last 2 months. Patient is claiming that she gained 5 pounds in the last 2 months. And again, we are making this statement's connection with the major depressive disorder. We know in this disorder, patient may gain weight significantly or patient may lose weight significantly. So what is happening in this given statement? Patient gained weight, which is quite a bit, 5 pounds in 2 months. It triggers us that this patient may have a diagnosis of depression, and we will select this given option. Option number 2, I called in sick 12 times during the 3-week period. What are we looking forward from this statement? We are looking if this patient is depressed. While this patient is saying that she called in sick 12 times during 3-week period, this indicates poor job performance. And we know poor job performance is related with major depressive disorder. And people who are depressed, clients who are depressed, they have poor job performance, they have poor social interactions. So calling sick 12 times in 3-week period indicates very poor job performance, and it triggers us that this patient may be depressed. So we would select this option. Option number 3, I sleep most of the time during the day despite having good sleep at night. So this patient is sleeping at night time, but then she's also sleeping during the day. What is she experiencing? She is experiencing hypersomnia. Hypersomnia is too much sleep. People may experience insomnia in depression, which is lack of sleep, and people may also have hypersomnia, which is too much sleep. And hypersomnia is again linked with major depressive disorder. It indicates this patient may be suffering from depressed thoughts. So we would select this option because of hypersomnia. That means too much sleep, sleeping day and night. Option number 4, I stopped attending music classes last month, which I was attending for the past 3 years. This statement indicates lack of interest in the previously enjoyed activities. So she was enjoying the music classes for the past 3 years, and all of a sudden she stopped now. What is this called? This is called anhedonia. What is anhedonia? Lack of interest in the previously enjoyed activities, and this is again an indicator of a major depressive disorder. So it indicates she may be suffering. So we would select this option as correct. Option number 5, I am very concerned about the cellulitis on my right toe. Client is concerned about a health concern, which is totally fine, and she should be concerned. And she has a health concern and she should be concerned about it. There's nothing wrong with it. If she was not concerned, then I would think that she is depressed. But again, because she is concerned, she has a health concern, it is totally fine. This statement does not indicate that patient is depressed, so I would not select this option. Option number 6, I'm planning to go visit my parents out of province in the next 2 months. I am very excited about it. So what this statement tells us? This tells us that this patient is looking forward for something, and which she's excited about. It does not indicate that this patient is depressed. She wants to do something which she is excited about. Perfect. No indication of depression. So we would not select this option. So that's all about this question. I hope this would be helpful. Thank you.